Hello, my name is Tanya Reed. I serve as a health educator for the Oklahoma State Department of Health, District 3. The purpose of this presentation is to provide guidance for our residents during the COVID-19 public health crisis. We have all heard about COVID-19, also known as the novel coronavirus, but we're going to go a little more into depth in this presentation regarding what COVID-19 is, the risks of the disease, COVID-19 around the world, understanding how the virus spreads, and individual actions you can take to help protect against COVID-19 and other respiratory illnesses. A novel coronavirus is a new virus that has not been previously identified. The virus causing coronavirus 2019, or COVID-19 as we know it, is not the same as the other coronaviruses that commonly circulate among humans and cause mild illness like the common cold. A pandemic is a global outbreak of disease. This can happen when there is a new virus that emerges to infect people and can be spread between people. Because there is little to no pre-existing immunity against the new virus, and because we have very easy global travel, it can spread worldwide. When looking at your specific risk, older adults and those of all ages with chronic diseases and compromised immune systems can take much harder hit with COVID-19. Some chronic issues to consider when knowing a risk are asthma, lung disease, heart disease, diabetes, obesity, and HIV or cancer treatments. There is currently no vaccine to protect against coronavirus, COVID-19. As you can see from the map, the virus has certainly spread globally. Because we are a very mobile, high-energy, fast-paced society, we are seeing increasingly high numbers in the United States. Protecting yourself and your family is very important. You need to know where to find sources of information, prepare your home, and know what to do during an infectious disease outbreak, whether it be an epidemic or a pandemic. How can you protect yourself from COVID-19? Clean your hands often. This includes washing your hands with soap and water for at least 20 seconds. Keep hand sanitizer available that contains at least 60% alcohol, and avoid touching your face. This includes touching your eyes, nose, and mouth. Other ways to protect yourself include avoiding close contact with those who are sick and putting distance between yourself and other people when out in public. How does COVID-19 spread? It spread mainly from person-to-person contact. This happens between people who are in close contact with one another, which is about 6 feet. It spreads through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby or inhaled into the lungs. It is important to note that COVID-19 can be spread by people with no symptoms of infection. Communities, businesses, schools, and other facilities or place of gatherings, such as churches, are encouraged to follow certain guidelines provided by the CDC, otherwise known as the Centers for Disease Control. We always talk about washing your hands, but this is one of the best ways to prevent the spread of COVID-19. Use soap and water and scrub your hands for at least 20 seconds, especially after you've been in a public place, used the restroom, blown your nose, or coughing or sneezing. If soap and water are not available, use hand sanitizer that is no less than 60% alcohol, and always avoid touching your eyes, nose, and mouth with unwashed hands. Did you know that there's a proper way to wash your hands? Step 1. Wet your hands with water. Step 2. Use liquid soap. Step 3. Lather and scrub for 20 seconds. This can be singing happy birthday twice. When you're lathering and you're scrubbing your hands, don't forget to wash between your fingers, under your fingernails, and the tops of your hands. Then you will rinse your hands for 10 seconds. You will dry your hands with a paper towel and turn off the tap. Another recommendation is avoiding close contact with other people. What exactly is close contact? This means putting distance between yourself and people not only outside your home, but inside your home if a loved one is sick. If you have a loved one in your home who is sick, Try to maintain a 6-foot social distance, which is 2 arms lengths. It will be difficult, but this will help prevent the spread of the virus. When going out in public, always remember people without symptoms can spread the virus. You should also stay away from crowded places or groups and avoid mass gatherings. Cover your mouth and nose with a cloth face covering when around others. Unfortunately, it is possible for you to spread COVID-19 to others even if you do not feel sick. The CDC recommends wearing a cloth face covering. However, this should be not placed on children younger than 2 years old or anyone who has trouble breathing or someone who is unable to remove the mask without help. This face covering is intended to protect others from being infected by you in case you have the virus. However, this cloth face covering is absolutely not a substitute for social distancing. Remember to keep at least 6 feet between yourself and other people. Here's a reminder for cough etiquette. When you cough or sneeze, cover your nose or mouth with a tissue or sneeze into your elbow, not your hands. If you use a tissue, discard the tissue in the trash immediately. And then, of course, wash your hands and or use hand sanitizer. It is possible that a person can contract COVID-19 by touching a surface that has the virus on it, then touching their mouth, nose, or even their eyes. This is why it's so important to clean and disinfect surfaces that are frequently touched. This includes places like tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, and sinks. Always use detergent or soap and water before disinfecting. And the great thing is most common EPA registered household disinfectants will work when cleaning to prevent the spread of COVID-19. What is social distancing? This means limiting face-to-face contact with others. It is really physical distancing yourself and keeping space between yourself and others from outside your home. To do this, stay at least 6 feet apart, do not gather in groups, and stay out of crowded places. In addition to everyday steps to prevent COVID-19, keeping space between you and others is one of the best tools we have to avoid being exposed to the virus and slowing its spread locally across the country and the world. We all play a role in slowing the spread of the disease. Spread can happen when an infected person coughs or sneezes, and even if someone is not showing symptoms, they can still spread the disease. The disease spreads mainly among people who are in close contact for a prolonged period of time. The virus can live for hours or even days on surfaces, depending on sunlight and humidity. And although the risk of severe illness may be different for everyone, anyone can get and spread COVID-19. Think about those close to you. Is someone elderly or immunocompromised in your family? What about your friends' families? Even if you don't think the disease will hurt you, it can hurt someone else. So here's how to protect yourself and others. Stay home. Continue to practice social or physical distancing. Wash your hands. Wear a mask when in public or in work in areas where maintaining a social distance is not feasible. And individuals who are sick should self-isolate from the public and other household members for 14 days and get tested for COVID-19. There are a wide range of symptoms that are being reported with COVID-19. Symptoms may appear within 2 to 14 days after exposure to the virus. People with these symptoms, or a combination of them, could have COVID-19, including fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle and body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. When to seek medical attention when you're feeling sick. If you have any of these warning signs, get medical attention immediately. Warning signs include trouble breathing, persistent pain or pressure in your chest, new confusion, bluish lips or face. This is not a complete list, so contact your medical provider for any other symptoms that are severe or concerning to you. If you are sick and have fever and cough or other symptoms, you could possibly have COVID-19. Most people only experience mild illness and can recover at home. If you think you may have been exposed to the virus, contact your healthcare provider immediately. Keep track of your symptoms, including fever, shortness of breath, and cough. And if you're having trouble breathing, get medical attention right away. Avoid sharing personal household items with others inside of your home. Do not share dishes, drinking glasses, cups, utensils, towels, or bedding with other people in your home during your illness. Wash these items out thoroughly after using them with soap and water or put them in the dishwasher. When you're sick, stay at home except if you're seeking medical attention. Take care of yourself by getting plenty of rest and staying hydrated. Stay in touch with your doctor and avoid the public at all times. Be sure to separate yourself from others in your home as much as possible and stay in a specific room and away from other people and pets in the home. If possible, you should use a separate bathroom as well. If you need to be around other people or animals in or outside of the home, be sure to wear a cloth face covering at all times. There are a variety of tests that are used to test for COVID-19. You can see the types of tests listed here. If you are diagnosed with COVID-19, a public health worker may contact you to check in on your health, discuss who you've been in contact with, and ask where you spent time while you may have been infectious and able to spread the disease to others. You will be asked to stay at home and self-isolate if you are not doing so already. How do you know if you've been exposed to COVID-19? You generally need to be in close contact with a sick person to get infected. Close contact includes living in the same household as a person sick with COVID-19, caring for a sick person with COVID-19, being within 6 feet of a sick person with COVID-19 for around 15 minutes, and this can be cumulative or at a time, being in direct contact with secretions from a sick person, being coughed on, kissing, sharing utensils. However, it should be noted that attending gatherings or events does put you at a higher risk of exposure, especially if you are not wearing a facial covering in public. Contact tracers work with the patient to help them identify who they have been in close contact with during the time they may have been infectious. Contact tracers then inform these individuals, the contacts, of their possible exposure. To protect patient privacy, contacts are only informed that they may have been in close contact with a person diagnosed. They are not given the name of the individual. Contacts are provided with education, information, and support to understand their risk. COVID-19 has a 14-day incubation period. So if you have been in close contact with someone who is infected, you should monitor your health for fever, cough, shortness of breath during the 14 days after the last day you were in close contact with a sick person. You should not go to work or school and avoid public places for those 14 days. If you are in contact with a sick person and develop symptoms such as fever, cough, and shortness of breath, you should completely isolate yourself at home, stay away from others, and contact your doctor for testing. This image explains the difference between a case, a contact of a contact, and the difference between isolation and quarantine. A case is a patient who has been diagnosed with COVID-19. Patients are asked to isolate from the public, others inside the home, and pets to separate from others to avoid spreading the illness. A contact is an individual who has had close contact with a case, meaning they've been in close contact within 6 feet for at least 15 minutes while the patient was infectious. Contacts are asked to quarantine for 14 days to stay at home and limit community exposure and see if symptoms develop. A contact of a contact is an individual who had close contact once again within 6 feet for at least 15 minutes, with a person who had contact to a case. These individuals should continue preventative actions such as washing hands, covering coughs and sneezes, cleaning surfaces, and being alert for symptoms. Contact tracing for COVID-19 typically involves interviewing people with COVID-19 to identify everyone that they've been in close contact with during the time they may have been infectious, notifying those contacts of their potential exposure, referring contacts for testing, monitoring contacts for signs and symptoms of COVID-19, connecting contacts with services they might need during their self-quarantine period. There are approximately 700 trained contact tracers currently working active cases in Oklahoma. To prevent the further spread of disease, people who had contact with someone with COVID-19 are encouraged to stay home and maintain social distancing from others until 14 days after their last exposure to a person with COVID-19. Contacts should monitor themselves by checking their temperatures twice daily and watching for symptoms of COVID-19. This slide shows the power of social distancing when you're considering one person who is infected over a course of 5 days to 30 days and their potential contacts of infected people when they are not maintaining social distance. Please continue to protect yourself and others from the spread of COVID-19. Preventing the spread of COVID-19 is possible. Avoid close contact with people who are sick. Don't touch your eyes, nose, and mouth. Stay home when you're sick. Wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use alcohol-based hand sanitizer with at least 60% alcohol, and avoid all non-essential travel. As schools are beginning to return to the classroom, here are some considerations. Educate. Staff and families need to know when they should stay home and when they should go back to school. Post signs. These should be highly visible locations such as school entrances and restrooms that promote protective measures such as hand washing and wearing masks. Clean and disinfect. All areas that are frequently touched such as playground equipment, door handles, sink handles, drinking fountains should all be cleaned and disinfected at least daily and really as much as possible. The use of shared objects should be limited as much as possible and cleaned between each use. This can include gyms, physical education equipment, art supplies, toys, and games. Other school considerations should be discouraging the use of sharing items that are difficult to clean. Try to maintain a 6-foot distance of space between seatings and desks. Try to ensure that staff and student groupings are as static as possible, meaning the same group of children stay with the same staff. This means all day for younger children and as much as possible for older children. Limit mixing groups if at all possible. Designate a staff person to be responsible for COVID-19 concerns at your school. All school staff and families should know who the person is and how to contact them. If it is possible, conduct daily health checks, such as temperature screening and/or symptom checks of staff and students. Besides the previously mentioned considerations, some other options in the classroom include ensuring hygiene products are available for student and staff at all times. Consider doing a seating chart in the classroom and on the school bus. Remember, when contact tracing of COVID-19 occurs, contacts are identified as a person who has been within 6 feet of a positive case for more than 15 minutes. It is important to remember to be realistic with these recommendations. Consider how this will work in your school or your classroom and make as many reasonable accommodations as possible. Here are some creative ways for no-contact greetings that you can promote in your classroom and at your school. Here are some key points to remember. Remember to frequently wash your hands. Continue social distancing. Wear a cloth-based covering when in public or at work. Stay at home when you're sick. Self-isolate for 14 days if you suspect you may have COVID-19 and get tested for COVID-19. You can locate resources and other recommendations at the coronavirus.health.ok.gov website. Here is a list of resources available regarding COVID-19. Remember, together we can help slow the spread.